You have the New York Times broadcasting a knowably false picture with at least 8 former CDC heads signing on, penning jointly with Rochelle Walensky among them, who many of us remember was basically a preposterous apparatchik who was, parroting the party line, brought no insight. So for them to be signing on with her in the New York Times, saying things that are knowably false, this is a test. Can you wrap your mind around the idea that Kennedy and the ragtag band, the ragtag fugitive fleet that have taken over the public health apparatus are actually right? Right. And that these other people with all of their austere institutions and degrees are actually saying things that if they do not know that they are false, they should know that they are false.
Yep. I just wanted to add, I just looked through some past notes, and back on episode 132 of our podcast in June of 2022, we talked about this reveal, which you can show my screen here. This is from Children's Health Defense, which was an organization headed up by Kennedy. And so, he has a long history of being clear and pointed in his critique of what he sees as anti-scientific and bad for public health approaches. And here we have, again, June 2022, which we covered back then. CDC admits it never monitored VAERS for COVID vaccine safety signals. In response to a Freedom of Information request submitted by Children's Health Defense, the Centers for Disease Control and Prevention last week admitted it never analyzed the vaccine adverse event reporting system for safety signals for COVID-19 vaccines. That's more than 2 years after they were widely being taken up by people. Or no, that's more than 1 year after they were widely being taken up by people. And this is when Walensky was the CDC director. Walensky also famously in some interview indicated that she had learned something about the status of what was going on from CNN.
Yep.
So, that person doesn't have any qualifications by which to judge anyone else's assessment of scientific or medical reality, because she apparently gets her news from CNN, even when she is supposedly heading up what they say in this op-ed is the world's preeminent public health organization.
And it is exactly what you would expect from capture.
Yes.
That effectively, if something like pharma captures something like the CDC, then the point is, well, you don't expect them to disband it. What they will do is they will staff it with people who are going to do what they are told. And Walensky was so obviously that there's no denying it. So to have these other people sign on raises the question about how far back this capture actually goes. I would also point out that Freedom of Information Act request that revealed that they weren't monitoring VAERS calls into stark question how it is that anybody makes the claim that these things are safe.
Well, that's why I was pulling it up. It's like they're making this claim, and one of the directors whose name is signed to that letter knows very well that they have no justification for making that claim, because they admitted themselves that they weren't doing the looking into the data that they claimed they had been doing.
Not only that, but this system, VAERS, is built so as to be extremely conservative is unfortunately a generous term. It is extremely conservative in registering harms. It is known to collect something between 1% and 10% of actual vaccine adverse events. It is also the only system that we've got to monitor the impact of a vaccine after it has been brought to market. So it is inexcusable that you would not be mentioning or that you would not be monitoring it, and therefore would not know that the COVID vaccines had an adverse event signal that was more than the combined adverse event signal of all of the other vaccines combined over the course of the 30 years that the system has existed. Right. So there was a massive signal. They weren't monitoring the system in which that signal accumulated. They didn't have an alternative. And at the same time, they were telling you that these things were safe. So the point is, they weren't looking at the evidence that would have allowed them to say anything on the subject, and they were telling you as if they were scrutinizing and couldn't find any evidence of harm.
One clarification.
Yep.
There were alternatives. They just didn't like them. You know, there were alternatives like hydroxychloroquine and ivermectin, vitamin D. But
absolutely.
But those weren't accepted by the CDC.
Right, absolutely. They were in fact sabotaged so that they were considered either non-functional or dangerous.
And by vitamin D, I mean sun exposure.
Right, exactly. Okay, so, all right, you've got fireworks at the CDC.
Well, I guess, yeah, fired, and then a bunch of previous directors right into the New York Times.
Right.
Yep.
So, yeah, you've got current director fired.
Yep.
You've got a bunch of directors writing in the New York Times, painting a picture, a false picture.
Yep.
Therefore, effectively co-signing the madness, right? If I was a former director of the CDC, the idea that I would be penning anything with Rochelle Walensky is a preposterous notion, but somehow they willingly did it. And my point is, it's very hard to wrap your mind around the idea that actually the rebels, unwashed as they may be, are right about all of these hazards. And this body, which is designed to protect the public's health, is doing the exact inverse of what it is supposed to be doing. Hence the fireworks that the New York Times would sign on to a stark false picture of what's going on. Tells you, basically what you've got is there are only two versions of what might be going on. Either the New York Times has it right, and Bobby Kennedy and all of his friends are actually cranks who don't understand health and are, at best incompetent and more likely malevolent, or that's not what's going on at all. And they are actually trying to protect people. And the New York Times is doubling down with all of these former CDC directors on protecting the captured entity, which is the CDC, from being liberated.